So, what does a psychiatrist mean when they say you have ADHD? So, there are 5 things a psychiatrist looks at when they say you have ADHD. First of all, what do the letters mean? The letters mean attention, deficit, hyperactivity disorder. Basically, there are two domains of symptoms we look at: the inattention domain and the hyperactivity or impulsivity domain. So, the 5 things that tend to organize how we think about ADHD are the following. The very first one is that there has to be a certain number of symptoms in the inattention domain and or the hyperactivity domain. For adults, you would want to have at least 5 of the 9 listed symptoms. And for kids, you want to have 6 symptoms in the inattention domain and or the hyperactivity domain. And you want the symptoms to be present for at least a 6-month period of time. So that's the very first thing, is the demonstration of severity of symptoms in the inattention and or the hyperactivity domain. Several of these symptoms have to be present in childhood, and these symptoms have to be present before age 12. So this is where the neurodevelopmental piece of ADHD comes in. So if an adult presents with symptoms and they are having attentional difficulties that has been ongoing for at least 6 months, we would have to do additional investigation to try to establish the presence of several of these symptoms in childhood. And now it becomes a little bit tricky because this requires retrospective recall on the part of the adult or the patient. We would also ideally need to get additional information. Could be from the parents, could be from friends, could be from teachers, or any person or individual that knew the patient as a child, so they could speak about the presentation of the patient in terms of inattentive or hyperactivity symptoms that might or might not have been present in childhood. Symptoms have to be present in multiple settings. There has to be evidence of the symptoms at work, home, social gatherings, in more than just one setting. If someone presents with ADHD in just, say, with schoolwork, it's less likely a neurodevelopmental process, potentially. The fourth criteria is that in addition to the presence of symptoms in multiple settings, there has to be evidence of impairments. And this could be measured by grades. So if, for instance, one is finding that they have difficulty with their grades, or they're having negative reviews at work, or it's negatively impacting their relationships. So it's not just that the symptoms are present, but that the symptoms have to be impairing or getting in the way of your functioning. The last symptom is actually how I usually begin my discussion. But it essentially says that the symptoms of inattention and or hyperactivity should not be due to some other cause, should not be due to, say, a mood disorder or a psychotic disorder. What I usually start off telling patients is that the presence of inattention is not synonymous with ADHD. So you could have inattention, and the job of the physician is to try to figure out what the cause of the inattention is. Is it from a mood disorder? Is it from a psychotic disorder? Is it because of poor sleep? Is it due to substances? Marijuana tends to be big on this discussion. Or is it just a variation of normalcy? So not every presentation is necessarily pathological per se. Or could it be neurodevelopmental, such as ADHD? The essential point being that if there has always been some other psychiatric process, this might be a better explanation for inattention than a neurodevelopmental process. However, it should be noted that ADHD tends to be very comorbid with a multiplicity of other psychiatric disorders. So having some other psychiatric disorder does not necessarily rule out ADHD, even though it might raise questions as to if ADHD is the best explanation. So those are the 5 things we tend to look at when we are thinking about diagnosing ADHD. That was a very, very brief discussion about ADHD. All right. Thank you for watching.